Having a model that can do COVID-19 segmentation might help us address this global pandemic. Unfortunately, these models require a training set to work. But since we have cases every day, we have potentially a lot of data. But most of this data are not labeled. And there are different ways of labeling them. So typically, models require fully supervised labels, which are very costly to acquire. But in this work, we propose a weakly supervised segmentation method that only requires labels that are very easy and cheap to acquire. This work was accepted at WACV 2021 and was in collaboration with a lot of people from UBC, Extract AI, McGill, Sapien ML, and Element AI. So COVID-19 has caused a problem for all of us around the world. There's more than 55 million cases and more than 1.3 million deaths. So the hospitals are super overwhelmed, especially since there are so many cases every day. So there are not enough beds to accommodate all these patients. And also, we still don't know the long and short-term effects. So because of that, people start developing systems to analyze COVID-19. And they work with CT scans, and CT scans are very accurate. They allow for effective diagnosis, understand assessments on the patients, and how the disease is evolving. And a lot of these deep learning methods were shown to be successful for identifying these infected regions. But these methods also require fully supervised training labels. So they require the radiologists to accurately segment the regions of the infected regions and put those in the training set. So that's costly and requires a lot of focus. So in this work, we propose a weakly supervised method, which instead only require point level annotations. So the annotator only has to put a single point for each of the infected regions. And this can take 5 times less than mask labels. And the idea of this method here is that we added a consistency loss as the novelty of this method. That what it does is it ensures that the output of the segmentation model is consistent under different transformations like flips and rotation. And by adding just this loss term, we're able to achieve new state-of-the-art results in this problem setup. So how does this work? So it's based on the fully convolutional neural network from the Lang et al., where we have an encoder that extracts the features from the input image, and the decoder that takes these features and outputs per pixel probabilities. There are 2 losses, point level loss, which is standard, and the consistency loss is the one we add here. So the point level loss, what we do here is that the point annotation is given by the radiologist. We just need to make sure that the output between the logits and the ground truth at those points correspond to the probability that we want. So for the points of the infected regions, we want the probability to be maximum for infected regions. The points in the background, we want them to be maximum for being background. So that's the standard loss. And then when we use the cross-entropy loss here. For the consistency loss, what we do is that we transform the input, extract the features, output the per pixel labels. We also transform the output with the same transformation. And then what we need to do is to make sure that the per pixel difference is 0 between these two. So which means consistent under this transformation. And what we use here for this loss term is the mean absolute error. So we tested this on 3 open source COVID-19 datasets. They're pretty small. Here's the number of their slices. They're around 3,000. And the percentage with infections is around 50%. And the labels are simply point level annotations on the infected regions and some in the background. So how we evaluate this is using 5 standard matrix, DICE, IU, PBV, sensitivity, and specificity. Higher is better. The idea here is that to identify how good your output is to the ground truth. So higher is better. So the fully supervised is our upper bound because it was trained on these ground truth labels. So they achieve around 78% DICE. But the ones that use only the point level loss, which is the baseline, they tend to output these very big blobs, and the result is very low. If we add a consistency loss that is based on flip and rotation, we boost the result to 68%. And as you can see here, the results are much better than the point level loss compared to the ground truth. So in this work, what we did is that we proposed to use a simple loss function that is based on consistency. And with that, we allow the annotator to only label a single point per region, saving a lot of time for acquiring training data sets, and also to achieve state-of-the-art results for COVID-19 weekly supervised segmentation. And the code is available online. Thank you.